we would like to thank our seminar supporter, Mitsubishi Tanabe Pharma America, for supporting this seminar. We would not be able to provide these educational programs without the support of our generous partners. So it's my honor to introduce our next presenter. Angie Conley is the president and CEO of Abilitech Medical. She'll be sharing with us information on the Abilitech Assist. Angie has served as Abilitech's president and chief executive officer since founding the company in late 2016. Under her leadership, Abilitech Medical has won numerous awards, including both the Techne Award for Innovation from Minnesota High Tech Association and the Grand Prize and Top Woman-Led Business at the Minnesota Cup. Abilitech has also been recognized as a top 10 medical device startup by MedTech Outlook, a top 20 medical device startup you need to know by Mass Device Magazine, and a top promising life science company by Rice University. In her role as president and CEO of Abilitech, Angie has raised over $15 million in equity funding and nearly $2 million in non-dilutive funding. Angie's broad work experience in the medical device industry directly translates to her role as CEO of Abilitech Medical. Prior to founding Abilitech, Angie held leadership roles in several different medical device companies, including working with exoskeletons at Magic Arms, peripheral and neurovascular atherectomy devices at EV3 Covidien, heart valves, instruments, telemonitoring equipment, external and implantable pacemakers, and defibrillators at Medtronic. She's an alumna of the prestigious Springboard Enterprise and Texas Medical Center and Praxis Accelerator programs and serves on the MedExec Women Board of Directors. Angie is named as an inventor on 2 patents. So Angie, welcome. We are happy to have you here today, and I will now turn the time over to you.
Awesome. Thanks, Melissa. I appreciate, or Marissa, excuse me. I appreciate the opportunity. Hello, everyone. And I just want to make sure that you're able to see my screen. Can you confirm that you can hear me? So great. Okay. Thank you. Well, thank you so much. What I thought I'd cover today is a little bit about the need for the upper limb assistive technology, an overview of our assist and the technology that we have, some of the patients that we've been able to help and the profiles of people who could benefit, and then how do you get it? And then we'll move into an access. What I'll start with first is, you heard a little bit about my background at Medtronic, where I worked on 6 different cardiovascular products. And then I met a 3D printed exoskeleton that I saw children with rare orphan conditions move their arm for the first time ever. And their eyes lit up and their parents looked like they saw a ghost. And it was just this beautiful, exciting opportunity. When I looked into it a little bit deeper, I found that technology didn't really work. It wasn't a scalable medical device, but it introduced me to this massive opportunity that, when you lose use of your legs, there is a wheelchair. And when you lose an arm, there's a prosthetic arm. But when you lose use of your arms, there are not really very many good solutions until Abilitech. And so what you'll see, hopefully here on my screen, is a woman that lived with a spinal cord injury that we met with, and she's a family therapist, and she said, this would help me return back to work, but I could paint again. And so it was so exciting to see. We said, well, come on back. We'll buy you, a paint set, and we'll meet you and you paint. So here she is moving with really controlled movement, something that is unique to our device and was really helpful. So let's talk a little bit about the patient need. And so this is a glimpse of a Duchenne patient from, I believe, the Parent Project, and some of the activities of daily living, because we know that if you lose use of your shoulder and elbow, you can't necessarily feed yourself the same way, and you can't live as independently. You can't always use a computer or open doors, turn on lights. And so here is a study of Duchenne muscular dystrophy patients, and what they've believed are the problems that Abilitech is trying to solve. Many of them. Drinking, eating, personal hygiene are often, amongst the top. What we've found across all, different patient focus groups is across the board, no matter what your diagnosis is, almost everybody, one, wants to eat, and number two, they want to scratch and itch. And so I was surprised here that touching or scratching your face was only a 4%, because what we've found is that it's often much more common. But being able to live more independently, and of course, this need can change from children to adults with muscular dystrophy, and the importance, because a lot of the adults are living independently and may not have a caregiver or a family member available to help them with these activities. So this is the problem that we're solving. We believe we're helping not just the individual who has this need, but we also hope to have a ripple effect, helping people and their caregivers and family members. We're supporting right here, when you start to look at caregiver, I'm sorry, oh, here we go. There are caregiver shortages right now. There's a huge demand in Minnesota, where we are located, and across the country. COVID exacerbated that. There are turnovers in the long-term care centers, and there is a huge 7.8 million, almost 8 million people that are shortage in the market right now. There are also financial constraints. Nursing homes are growing in cost. For a semi-private bed, it's averages $90,000, and 1 in 3 people across the country often leave the workforce to stay home and take care of a loved one. And so a 5-year study in Australia of adults, where we looked at functional activities of daily living by the patient and compared with the home-based care study, they found that there were fewer home visit care hours and incurred a lower cost of care in the home, and they were less likely to transition. So if we can support people in the home, they're less likely to have to leave. They were less likely to be admitted to emergency care or to have unplanned hospital admissions. So what is this overview? What has been out here? This is a problem that people have been trying to solve for a long time. And you can see the Hokomar Mayo Spring is a rehab device on the left. You'll see a Luke arm on the bottom left, which is, I guess I'm going counterclockwise, but you'll see solutions for prosthetics. You'll see unpowered devices, myoelectric devices, which always have to be calibrated to the muscle, and often people who live with muscular dystrophy don't have those strong signals needed for some of the myoelectrics. And then there's industrial solutions to help, really a different solution of people lifting heavy weighted objects. This is a short video. I'll turn up my volume so it comes across, but it really addresses this huge need. And this is what, when I founded Abilitech in 2016, I found that there are over 1 million people in the US who can't live independently and use their arms. And so this is, just take a quick listen. Thanks.
My name is Jimmy Nelson. I'm a nurse and also a caretaker. So as a personal care assistant, I do see the firsthand effects that stem from both physical limitation and constant dependence.
In our field, there is a lack of devices that can treat the upper extremity in a way that allows it to be independent for longer with less use of energy.
One thing I like about the Abilitech assistive technology is that it allows them to do things for themselves for longer periods of time. It really decreases that amount of burden where somebody else is always there having to help them lift, move, feed.
Patients having a device, they get to be more independent. They get to eat by themselves. They get to talk on the phone independently. They get to fill their own medications.
So they can rejoin their community. They can go to school. They can maybe go to work.
I believe that the Abilitech Assist definitely has the power to give someone their independence back. I mean, how amazing is that?
Okay, so that gives you a perspective often from a caregiver and you know, a user and clinician about the potential for an assistive device. And we always talk about having physical impact, helping people with activities of daily living, a social emotional impact, helping them be more active in their home, community, and sometimes work, and an economic impact, really offsetting some of the costs of care and potentially returning to work. So when we look at our Abilitech solution, hopefully the video comes through, and this man was able to turn pages of the book, use his arm, drink coffee, eat cookies, do things, and didn't rely on his wife the same way he typically did. What's unique about this gentleman is he had subluxation of his shoulder, and he reports not needing to take his pain medication as often, and actually only took 3 pills the month we spoke to him last out of the 31 because his shoulder didn't hurt. What does that mean? Our device takes the weight of the arm and the armature, and he's wearing a vest, which you can't really see, and that's the idea, but it spreads the torsion or the weight of the device across the body and into the hips so that it feels completely weightless. People report that it feels like they're in a swimming pool and that their arms are floating weightlessly. And our engineers, they talk about our device as the wheelchair for the arms. We are the only device that really provides a shoulder and an elbow assistance that the patient controls. They move. Unique to our device is also that we can lift different weighted objects. There is an accessibility switch that you can press once, twice, low, medium, and high. And so you may need a different lift assistance for a spoon, a cell phone, or a 12-ounce bottle of water. And that's important because if we just automatically drove the patients, if the device took over, the person would get weak and their muscles would atrophy and die. So the engineering challenge that we have addressed is really working with existing function. And that typically looks like a manual muscle test of a 2 or a 3 in the shoulder and elbow to be able to initiate some movement. So there's clearly some people who will be too strong and others who will be too weak that cannot benefit from our device. It's motored by springs. And what that means is that the motors just tension the springs for those different levels. But that allows the device, you can see their natural movements that where the arm can glide. It's not really jerky and like you might see in some other technologies. We're able to calibrate the device, the first fitting, based on the weight of the arm and the tension that's needed. If the patient gains a lot of weight, 20, 30 pounds, we may need to come back. Otherwise, it should be set for the lifetime of the patient. We can take it on and off within about 2 minutes, and we've tested that. And then there are sensors at the shoulder and elbow. So our patients, the people who have used our device talk about it as being comfortable. They like the core stability that the vest provides and that it can prevent the slouching over and some of the use of the little small muscles in the neck that help support when the larger muscles weaken. And it's intuitive. There's no learning curve. People put it on and are like, oh, low, medium, and high. And that's pretty exciting. I talked a little bit about the impact of physical, social, emotional, and economic impact. It's more intuitive, but very, very important. And that by helping individuals, we also believe that there's a ripple effect and that we're helping sometimes their family, caregivers, or others that are important to them in their life. This is a profile of who we've been able to help, a Duchenne muscular dystrophy child. This is his ability without our device, and you can see the finger crawl because his shoulders have atrophied. And so he's going, moving up, which is very, very typical. So we're looking for this kind of level of intervention where they can initiate that movement, being able to use a wheelchair. We are working on a next generation device that will allow us to treat people who can walk. So very exciting. You do need a caregiver to don and doff, to put it on and off. And so this is just sort of an illustration. We typically fit people who are about 5 foot to about 6'4". And again, we focus on activities of daily living. You'll see here the eating, drinking, brushing your hair, putting on makeup. What's important here too is that these are really controlled movement. The person is able to control their movement and direct where they'd like to go using different weighted objects. Again, we'll look at this baseline on the left of this patient with Duchenne, and you saw his finger crawling. And then we put in a pop can in the middle frame, and he, it's heavy for him, and he's not really able to lift. You'll see his elbow is on the wheelchair arm and is using it to lift up. And then in the last frame, we're able to help him, and he has the device on there. And it kind of pops up, and it surprises him at first because it's a little bit easier than he thinks. He feels like he's going to have to muster and he starts later to be able to do a little bit more control because he says, oh, I don't need that much lift or input. Here is another person that we helped with muscular dystrophy at Gillette Children's. And this gentleman is lifting a water bottle. And you can see that his body kind of slouches over and he struggles with, sorry. This video is not playing like it should be. What I will narrate for you is, maybe I just have to go through, but he is able to, like the other gentleman, be able to use controlled movements with and without the device. Another person with muscular dystrophy, and we'll show the before on the left. I apologize because for some reason this is not playing and it like it should, but you can imagine where here on the very end, this gentleman is able to feed himself. Well, he has a face mask on, but he's able to take in a controlled movement, feed himself some applesauce, which he was quite excited about. I mentioned earlier, eating is one of the top, and scratching an itch is a second. And so what I will see here is, he is just goes crazy on his head, and he just is smiling and so happy to be able to comb his own hair. And it just feels so good. So, And apologies if this is not coming through quite as well, but you can see him helping. This is a woman, 52 years old, who lives with ALS. She has 3 boys, 2 in high school, 1 in college. And this is a video that, thank goodness it's working. And you can see her ability to use this controlled movement. She wanted to play Jenga with her boys. And so very exciting for her. We do, help people with, we've helped people with ALS and spinal cord injury, but most of our work has been in muscular dystrophy. Here is somebody who uses our device with, who lives with a spinal cord. He's a quadriplegic, lives full-time with his mother, who's a nurse. And you can see him struggle to lift a 2.4-ounce granola bar. And then again, you lift with ease and be able to feed himself for the first time in a long time. And then on the 3rd frame, you can see him trying to lift a water bottle. And then with our device, he's able to move that in a controlled manner. Here's a few more befores and afters, spinal cord, but this gives you a feeling of some of the baseline. She's a little bit on the higher end. She tries to do lift with 2 hands and can do it, but not repetitively, and 1 hand. That's about as far as she can go. She was the same person who was painting earlier. And then she had to kind of relearn this muscle group, of being, because it had been a couple of years since she had been able to move her arm like this. So her therapist is saying, she's tapping her bicep and saying, bicep, punch the ceiling, and she's getting it. And it's really quite emotional. You'll see her excitement then when she gets her hand to her mouth. And the surprise. And then again, with our device, after a couple practices, she's able to do this much more fluidly, which is very exciting. I was there in San Diego at this gym and was able to ask her, what does this feel like? And it's just some raw footage here. What does this mean to you?
I'll cry. It means more independence. It means the next step. It means hopefully no pain. With that, again, like quality of life and being able to have an outlet. Because a lot of times to have thoughts and emotions inside, but not being able to express them in a healthy way. Like with painting or writing or journaling, I'll be able to do those things. And it's not just everything being bottled up inside. Yeah. Means new lease on life, right? Mm-hmm.
Yeah. And it is not uncommon for us to see that burst of emotion of when people are able to do things for the first time in a long time, and the pride and the doors that open to new possibilities. Well, what does this mean to you? Sorry, I'm trying to move through. This is another person that we fit in Texas. And we were very excited because her therapy group brought it into their rehab and embraced it as part of, teaching her to use new muscle groups. So again, she had a stroke and a spinal cord injury. She was able to open doors. She is able to practice with tennis with new muscle groups. And I call this whack-a-mole, but really these are the muscle groups that are required to kind of navigate a table or a workforce. We've had significant clinical partnerships of people that get very excited about our device, the potential. They've helped provide feedback. We did do a muscular dystrophy study and cerebral palsy rather at Texas Children's. We have Gillette Children's and the University of Minnesota here who have been working with us, along with many others, many other partnerships. This is not something that, you know, my background at Medtronic, where I, you know, would create a heart valve or a pacemaker and you could test it in an animal and then go into human testing. We really, everybody comes in different size, shape, and forms and etiologies and different needs and different muscle groups and strengths. And so we've been able to work with a lot of clinicians. We welcome feedback from, you know, everywhere to be able to understand how to best serve our patients and their populations. This is a short video about the study that we did at Gillette Children's.
Gillette Children's Specialty Healthcare in St. Paul. Yeah. Joe Borbu is showing how he lifts up objects, from spoons to use both hands, okay, to water bottles. The 14-year-old was diagnosed with muscular dystrophy before his 6th birthday.
He lost function in his legs, and his arms are weakening.
Mom Jessica helps her son do things like brush his teeth. Other tasks that can be a challenge:
Drinking, eating, scratching an itch on my head or something.
But Joe started using the Abilitech Assist.
Joe, so I'll have you just relax here.
It supports and assists both the shoulder and elbow.
So our device has springs and motors to help create custom profiles for patients to support them in lifting different weighted objects.
Going from this to this with something as lightweight as a spoon.
Right.
Or this.
Can you move the can to my hand over here?
To this with an item as heavy as a 12-ounce can.
How's it feel when you're doing that?
Pretty good.
Pretty good. Something like this could be life-changing, that it could offer him to be able to do this stuff by himself and he wouldn't need help.
It's way easier.
With the weightlessness of this arm, it's just fascinating. We help quite literally open doors for people.
Angie Conley is the founder and CEO of Abilitech Medical. The Eden Prairie-based company got its start nearly 5 years ago.
When we are able to fit a patient and see the lights go on in their eyes or their parents' eyes and know that we're making a difference in their lives is just a phenomenal reward.
We're hoping that it'll affect a whole lot of children and adults with disabilities.
Dr. Mark Gormley at Gillette will be leading new research. Abilitech is teaming up with Gillette and the U of M to study their device.
Yeah, that looks awesome.
Looking at daily activities and quality of life.
We're hoping that this device helps children with muscular dystrophy, cerebral palsy, strokes, and various other disabilities. So we're going to try our best to find those kids that will work best with this device and improve the device.
When somebody loses use of their legs, they get a wheelchair. When somebody loses use of their arms, we'll have Abilitech as a solution.
How's that feel, Joe?
For Joe, it's helping him do more things on his own.
For every parent and caregiver, it's a really big blessing to have technology like this.
Maybe reach out to here.
We're behind the business. Heidi Wigdahl, Fair 11 News.
Looks good.
And I'll add that we are looking to enroll more people in this study at Gillette Children's or the University from Minnesota and surrounding areas. So if there is of interest, please reach out to info@abilitechmedical.com, and we would love to talk with you and connect you. We are actively looking for people, and they'll work with you, especially existing patients, but we're open to working with others who can make the commitment to do the 3-month study. When we look at the assessments for upper limb devices, we begin, with a virtual. So if you call Abilitech, we'll talk to you. We'll do a free confidential assessment and evaluation with video to understand what is your need, what's your current motion and range of motion, and can you benefit, and what are your quality of life goals. Some of the questions, if you are someone who's considering this technology, many people are interested in activities of daily living, and some may be interested in a rehabilitation you lose some function. And if with moving with intention and repetition, and a stroke patient can facilitate the neuroplastic healing. We believe that using our device may slow the atrophy. We have yet to prove it, but we do believe that use it or lose it, and being able to use this daily in your home is really a benefit to you and the muscle groups. One of the things is, can it assist? You may have one stronger arm than the other, and so you can consider if it's a two-arm bilateral task or a one-arm unilateral. Is it designed for people right now? It is. Our current device is designed for people who need to use a wheelchair or are willing to sit down and use it in a chair position at the dining room table or at a desk. It's not meant to be walking around, because we do have a 10-pound power pack that typically mounts to the wheelchair or sets right next to it. How easy, you can ask yourself, it is to take on and off, how much it could be calibrated. That's pretty, we'll work with you and talk with you about that. And, it does support intuitive movement. And you can follow up with any other questions. I won't read everything, but it does support different weighted objects. And again, it's pushing an accessibility switch once, twice, or 3 times to be able to adjust the spring tension, which adjusts, to help assist the muscle groups. So here's the Abilitech process. We do have an in-house reimbursement and customer care team that is designed to help work with you and your family. It starts with a telehealth screening program. Then we'll do an orthotic evaluation with an occupational or physical therapist. We will need to get a prior authorization from your insurance. It is not all insurances will cover it, but we will handle the brunt of this. We have a full team that is skilled in this, and we'll make sure that it is not the burden on the clinician or on the family, and we'll lead this process. And then once we get the prior authorization, we will deliver and train you and your family on the device and help connect and support. I saw one question come through about abroad, and I will answer that. Right now we are approved to fit people in the United States and fit people in Canada. And abroad, you would have to come and be fit here, and to be able to pay for the device. We do have, and I'll speed up so we have time for questions and answers, but the Abilicare's program, we meet with your care team. We want to talk to you about your assessment, understand, we'll work with your prior authorization. Then we sit and we train you and your family, which is pretty intuitive, but we are here. We have a full team built out, and then working to help provide the support needed so that it's continued to be used in the home.
I'm rolling. Go ahead.
So I'd ask that you follow us on Facebook or LinkedIn, YouTube, Instagram. We have a lot of different ways. Reach out. We're at Abilitech Medical. You're going to find a lot of patient stories and clinician stories and information about our company. We'd be happy to talk to you. And with that, I'm happy to answer any kind of questions that might be in the chat.
Angie, thank you so much. I mean, incredible technology. It looks like there's a question about, is it available for adults?
Yes, it is. Thank you. We do fit people from 5 foot to 6'4", so we can fit adults. And there are several adults like Mr. Cutt, the therapist, and the woman that lives with ALS that are using our device. I see one quick question that pulled up of how heavy can it support? It really depends on the weight of your arm because we're working with the weight of the arm, but it typically, this first gen device will fit, around up to 220-pound person.
Looks like there's another question about insurance. Will insurance pay for the device?
So it's, there could be 10 women on this call, and we might all have Blue Cross Blue Shield, and we might have different policies within Blue Cross, and insurance can be a quagmire. And so the answer is we will work with you to help you determine your insurance and if it will be covered. There, we are in touch with some of other opportunities to try to help you get it funded and get it paid for. Our commitment, this is a very mission-driven, we're a business, but we're here to make an impact. And I can't tell you how many, what it feels like to be part of our team. And we are committed to try to make it affordable and accessible.
So along those same lines, are you able to give kind of an estimate of what an average patient might pay? What kind of the cash up front might be?
Yeah, it will all depend on your insurance is like the really fair answer. We did get a Medicaid to approve it today, hooray. So, sometimes, it depends on if people have Medicare Advantage, if you're, a Medicaid patient, and Minnesota is going to be different than Florida and Texas. So it will depend. It'll depend on, if you're, and we are working with, we're introducing this technology. What's unique is, unlike a drug that you don't know if it's going to work or not for a patient, or what the outcomes will be, we can fit people before we do even the submission, patient-specific outcomes. And we can say, Angie can benefit. She can now feed herself. She can eat. She can brush her hair. She can brush her teeth. She can open doors. Do all these different things, and that goes into the insurance claim. So I think we've really worked hard to try to make it as, of an easy process, but it's not easy. We're bringing a new technology to market.
For sure. It looks like there's several questions in here. Is there a warranty for the product?
We have a 3-year warranty. We expect it to last 3 to 5 years. This is very consistent with a wheelchair.
Sure. Can it be used by a child with Duchenne who underwent spinal fusion surgery?
That's a good question. And we have worked with people with Duchenne, but not post their surgery yet. It depends on if they have that requisite movement of a manual muscle test of 2 or 3 in their shoulder and elbow. So if they have that ability to lift their elbow off the table and slide their hand across midline, those are good indications, like in the video, that they may be able to. So that, again, will be dependent on each person.
Okay. Can a person reach over their head with the device?
No. So that is what they can do is get their head or their elbow up about here and their shoulder up here and flexed. We did that intentionally because a lot of people, including people with spinal cord injury, have rotator cuff issues or subluxation. And we didn't want, our first gen device we want to make sure nobody would get hurt. Our next gen device that will be available in 2024 will have that ability to reach much more higher.
How long does it take to fit and then train the caregiver?
Great question. We're getting better and better about all of our education, but we typically like to do about, gather some information ahead of time on sizing so that we can come prepared. And then it takes at least an hour to be able to fit the patient and calibrate the device specifically to their strength profile. And then it can take some time to fit. The vest is something you're going to wear every day. So that can take another, half hour. So it's not unlike, going to wheelchair seating clinic or something, that it takes a little bit of time. But then it's done once and hopefully, for the lifetime of the device.
Tons of questions coming in. We'll try to get to all of them. When will the device be available for ambulatory folks?
The device will be available in the fall of 2024.
Okay. And sorry, there's a couple different places questions are coming in, so I'm trying to make sure we look at them all. Would it be able to be attached to a power chair that also has a ventilator?
It'll depend. Typically, a vent is in our exclusion category, but it's always patient specific. I guess when you have questions, and if we don't get to any of your questions, I'd encourage you to reach out on the Abilitech website. We're happy to take your call and understand if the Abilitech Assist is for you. If you're on a ventilator and are able to have that requisite strength, we might be able to help.
And have you worked with any patients that have inclusion body myositis that you know of?
Yes, we have.
Okay. And then a couple more questions came in the Q&A here. There's several questions about, without insurance, what would it cost? Are you able to share that? Like if somebody was private pay?
Yeah, I'd reach out and ask that they connect with us, and we will talk with you. And there are other options of sometimes grants or foundations to work with you. So we're happy, and the next gen device will be even less, or will cost less. Yes. We're building and we're super committed, but I always liken this to my dad's calculator that was $1,000 and it was huge and, growing up, and now it's in our pocket on our cell phone. So yeah, we're in the process, and it's a process.
For sure. And then, because you did mention contacting you, what is the best way for folks to contact Abilitech?
I think if you send an information, if you go to our website and there is a form that you're interested in filling out for a telehealth evaluation, that's the best way.
Okay. Do you work with the VA, with the veterans?
The answer is yes. We're building relationships with the VA. We're quite interested in working with them. We've had a few in-services and would welcome the opportunity to work more with them more closely.
Could a person lift the weight of like a gallon of milk? Would it be able
to? We have seen that, yes. And so there are certain people that are on the stronger end, and it depends on how strong, but we have seen one individual lift a 5-pound weight or 8-pound weight with perfect form. So it's again, patient specific.
And then another question, any plans of training people who want to learn about the technology? Do you demonstrate at all at like any ability expos?
Yeah, we're a very small startup, and we have plans to go to the expos. Again, reach out. We have 3 sales reps in the field. We had plans to go to MDA as well, to the annual meeting and SMA families. And so we are at some of the walks. And so we would love to be able to, but this is not a device, I will say, that can fit one person at 8 o'clock and another at 9 and another at 10. It is custom fit. And so that takes a little bit of time. So there is, but we're happy to work with you. Please send us an email.
And then I think we have time for a couple more here. Is there a way for patients to be able to test out the equipment before purchasing or keeping it?
Yeah, absolutely. And so we're very interested in that. If you live in the Minnesota area, we certainly could do it through a clinical study, or you could come into our office because we're certified here as well. But every evaluation that we do, we have somebody, we fit them and understand, is this right? We're not going to sell it to anybody who can't benefit. So we would and truthfully, we have to work pretty hard to get these early insurance prior authorizations. So the patient needs to want it and their family and have that. We know that function is one important criteria, and two, that whoever the user, they need to want it so that we can get it through. So yes, we want you to want it. We want you to try it on.
Is this wonderful device useful for ALS patients?
Yes, the woman that you saw with who was playing Jenga in that short video in the beginning, she is a user of our device. We've had 2 ALS users.
Well, really, this is so amazing and exciting to see what's next. Oh, it looks like a couple more questions here. They just keep coming, Angie.
That's good. Thank you.
It looks like recommendation letters. Do you need something from orthopedic or a PTOT to get the device?
Yes, as part of the prior authorization, we need a prescription from the doctor. So what we typically do is work with the occupational or physical therapist, or put you in touch with one, do that assessment of the without our device and with our device, demonstrate the difference. Sometimes we show video, we share, we understand what this could help this unique individual do, because it's always patient specific outcomes, and then we'll work with you to get it on. I guess that's the best way I can say. Well, then we often go back to the doctors. Sometimes the doctors bring a patient to us. Often it's the occupational therapist or physical therapist or a physiatrist. We'll be at the AAPM&R meeting with a poster session done out of Gillette in about a week.
Exciting. That kind of leads nicely to the next question. What city is the clinical trial being done in?
Minneapolis and St. Paul. And, I'll say that we're really looking for, now that, oh my goodness, we're looking for I had put it on for an hour and I guess the hour is over. But we are looking for partnerships. So I will say that we have some devices. We are willing to work with some of the muscular dystrophy groups or patient-specific muscular dystrophy groups and partner where we could, donate 5 devices and in exchange have a center help study 5 devices. So that is something that we're very much interested in, or with the ALS Association as well. We want to get it onto the arms and be able to make a difference. We've been working at this for 6 years, guys, and it's really exciting to be here.
Well, we're glad to have you. Will any of the tech be open source?
Not right now. This is, it's a hard business, but we really need to pay our employees.
Sure. All right.
But I do have visions of having a foundation, and we are interested in working with other foundations or advocacy groups to help co-share studies and help get this on the arms with other people. So when I founded Abilitech, I thought even of a B Corp, where it was sort of like a nonprofit business, but we really needed investments to be able to develop this medical device. So.
Sure. Okay, well, I think that wraps up our questions. Angie, thank you so much for being here. We appreciate you sharing this information about an amazing device. So as everybody, it looks like people are asking if it's been recorded. We have recorded this, so it will be made available in a couple weeks. You'll get a link. But thank you again, Angie, for being here.
You bet. And I'll just ask everybody, please reach out on Facebook, share our videos, like us. look on LinkedIn. We want to meet people. We want to help people. We're here and very excited. It's kind of game time. So thanks again for all of your questions and the opportunity to talk. And we look forward to hearing from you all.
Thank you, Angie.